The hot temperatures are not going anywhere soon, and doctors say that certain medications that you're taking could make you more sensitive to the heat, especially for older adults. 5 News reporter Rachel Williams is taking a closer look for us at the other factors that can raise your risk of heat-related illnesses.
On days like today, where temperatures are above 90 degrees, the heat can cause risks for seniors and those who have health problems.
When you know that you're taking a diuretic or a water pill for blood pressure issues, it's important that you stay hydrated. It's important that you take additional fluids on top of what you would normally do to make sure it's not affecting you adversely.
Dr. Pachala with Mercy Clinic specializes in seeing patients over 65 and says the most common issue among older adults during the summer is dehydration.
People think coffee and soda and alcohol count as fluids. They don't hydrate you. So it's important to note that you do need additional plain water also in between to make sure your kidneys are adequately hydrated, especially if you're working in the yard in these higher temperatures.
And that means replenishing your electrolytes, which will help keep you hydrated in addition to water. She says it's also important to keep certain medicines out of the heat and never leave them in your car.
I specifically mean insulins. They cannot be left in cars, especially in a hot summer day, not even briefly. It needs room temperature if you're actively using it, and if it's a new medication, it needs to get into a refrigerator as soon as we can.
Doctors and pharmacists say several prescriptions like antibiotics and topicals can cause sun sensitivity.
There's a few like sulfa-based antibiotics that tend to cause sunburn more easily. A lot of topical medications can cause sunburn more quickly as well. So topical medication is anything you apply to the skin, so like a cream or an ointment.
Pharmacy owner Andrew Mize says most diabetes medication needs to be refrigerated, but other prescriptions just need to be at a certain temperature.
Heat can really damage medications, make them less effective oftentimes, and so you want to make sure they're stored properly. Most medications need to be kept below 77 degrees Fahrenheit, so normal room temperature inside your home.
And inside assisted living communities, keeping medications and residents cool is a top priority at Brookstone.
So we do have a hydration station in the community located in the lobby that we provide refreshments. We encourage, of course, extra fluids when they're taking their medication or at the dining services. So our goal is to always keep that encouragement and keep them hydrated, especially with the heats being as hot as they have been.
Brookstone has indoor and outdoor events for residents, but with scorching hot temperatures, it's a certain time of the day.
If it's outdoors in the summertime, it's typically going to be your morning hours. Definitely your morning hours.
Covering news where you live, Rachel Williams, 5 News.
And doctors also say that taking drugs like diuretics and high blood pressure medications may actually make it harder for the body to cool itself down. And staying hydrated no matter your age is important during the summer. Again, make sure you're drinking those electrolytes too.